Every election year is important. As citizens, we need to understand the issues so we can make informed decisions when casting our votes. That's why I have two special guests in the ring with me. In the blue corner is incumbent Democratic Senator from Wisconsin, Tammy Baldwin. And in the red corner is Republican challenger, Héctor. As host, I will be in the neutral corner, facilitating a robust discussion with each candidate's Health and Human Services platform. These interviews were recorded separately. I asked each of the candidates the same questions in the same order so that you, the voters, can make a side-by-side comparison and are ready to go to the polls. Let's go, champs. Hello, and welcome to In the Ring with Héctor Colón, the podcast that knocks out the challenges facing the social services sector and the people we serve. I am your host, Héctor Colón. In the ring with me today is our Wisconsin Senator, Tammy Baldwin. Welcome to the ring.
Oh, it's wonderful to join you today. Thank you for having me.
Thank you so much for being here. We're going to share a little bit about Senator Baldwin. She hails from Madison, where she was raised by her grandparents. Her commitment to public service stems from childhood, watching her mom experience mental health challenges, chronic pain, and substance use disorder. Tammy, can I call you that?
Yes, you may. That's how I know I'm home.
Okay, thank you so much. Tammy also experienced a serious childhood illness that sent her grandparents down a health insurance rabbit hole, ultimately denying her coverage because of a pre-existing condition. In the late 80s, while she was still in law school, Tammy began her political career, filling a vacant aldermanic seat in the Madison Common Council. Eventually, she became a member of the U.S. House of Representatives. On November 6, 2012, Tammy was named the United States Senator of Wisconsin. Throughout her career, Tammy notably helped craft the Patient Protection and Affordable Care Act. She also introduced the Comprehensive Addiction Resources Emergency Care Act, which provide $125 billion in federal funding over 10 years to address fentanyl and opioid epidemic across Wisconsin and the country. Are you ready for round one?
I'm ready for round one.
Let's go, champ. So we want to understand your Health and Human Services platform. What are your top two priorities?
Yeah. So I'd like to just say a little bit more about the background because, I was served on the Dane County Board of Supervisors when I was in law school. And I became a leader on the Human Services Board, where, the county is very active in funding organizations that directly provide mental health services, substance use disorder services. Back then we called them AODA services. Yes. The things have changed. But I became so intimately familiar back then, and this was many years ago, with the challenges that nonprofit organizations were having in having enough resources to meet the need. And that continues to this day, even though we've seen many of the challenges that our society is facing change over that time. And I hope we can talk a little more deeply about substance use disorder and what we saw back then versus what we're seeing now, because it has changed in some ways. But in terms of this sector, I think we need to, as we are in a crisis period with regard to mental health, people feeling depressed, despair, isolation as we emerge from the pandemic, but also seeing alarming rates of overdoses and challenges with substance use disorder. I think those have to be the two priorities, and making sure we have a robust network of partners able to step up. One other thing I would mention, and so a number of years ago, I co-led bipartisan legislation to create the 988 hotline. For those who don't know what that is, that's a suicide prevention and mental health crisis hotline. There's always been one, but it used to be a 10-digit number that nobody knew, right? And now we make people aware that help is just a call or a text away. As that was stood up 2 years ago, we now have a lot more people reaching out for help. But we have to send resources behind that, because it's one thing to have your call answered and sort of walk through the crisis, but there also needs to be community referrals you can make afterwards to continue the support. And so putting adequate funding behind the network of organizations that support 988 and people in mental health and substance use disorder crises is a huge priority for me, and one that I'm fulfilling in my role as a U.S. Senator.
Thank you. Certainly mental health and addiction are significant issues facing so many people. In fact, 1 in 4 of us experience a mental health condition or face a co-occurring addiction. So thank you for sharing those as your priorities. Through your specific Health and Human Services platform, what outcomes would you like to see for individuals that are experiencing those challenges?
Yeah. Well, first of all, ample resources that we can then prevent things from getting worse, right? So we don't invest nearly enough in prevention activities, whether that's with young people about the dangers of addiction, but also with mental health, catching things early. If you come to know somebody who's maybe had a trauma in their life, trying to make sure that it doesn't get exacerbated over time. I'd like to see more mental health services in schools. That's a place where we know all of our children will be. And if they can connect there, if the school mental health services, whether it's social workers or people trained in psychology, et cetera, can find those who might be in need earlier. And there's so much that we could prevent with early identification. And then, as I said before, at the other end of the spectrum, the crisis end, we also need to make sure that people in crisis not only have the 988 services to sort of de-escalate, but the next day, they need to be able to call somebody else and establish maybe a longer-term relationship with somebody who can help them navigate through their crisis.
Thank you for mentioning the prevention and early intervention, because that's what we're all about at LSS.
Yes.
Our system is pretty much, it's reactive, and it waits for someone to have a mental health crisis when they're 17 and 18 years old, and sometimes it's too late. Or we wait for someone to penetrate the criminal justice system, and it's too costly. We could lose these kids. And so getting to these kids early we have a school center mental health model, which does exactly what you're talking about, getting to these kids early, using the school as a hub, wrapping around services for the family, because the better the family is, the better that child is going to be. And so related to early intervention and prevention, it seems difficult in our political system for us to really move upstream, because early intervention and prevention doesn't happen within the political cycle. It might take a decade to really show, or more, to really show the true impact and the results that we have with early intervention programs. What are your thoughts on that? I know you're big on early intervention prevention, but as it relates to that political cycle, and the difficulty it is for politicians, quite frankly, and government to buy in.
Yes. Well, first of all, one of the challenges is it's hard to produce evidence of what you've prevented. There are some ways of measuring how well prevention works, but it's hard. And so people want to make sure they're investing in something, and they want to see the results, see the statistics, see the data. But I can tell you, I'm going to go back in time, one of the ways you can approach this. With our human services budget in the county board that I sat on, we said we should have at least 1% of that budget dedicated to prevention activities, and then another 5 to 10% of that budget dedicated to early intervention activities. And we kind of got buy-in from the group that, we're only talking about 1% for pure prevention activities. But let's not walk away from that. Let's make sure we do at least that. And that's not an insignificant amount of money, I might add, when you're looking at a county's entire human services budget. And so I think that's, one approach that avoids the political divides is let's pick a number and make sure that we are keeping to it. Mm-hmm. And always making sure that there are both prevention, early intervention activities, as well as, the far other end of crisis intervention at the other end.
I agree. You need programs that address all of those issues. And I'm glad that you have early intervention as something that needs to have a focus. And I would argue we need more resources in that bucket over time.
Yes.
Because that's what's really going to improve the health and well-being of Wisconsin residents and from people all across the country.
And financial resources supporting organizations like LSS, but also the workforce.
Right.
We're experiencing right now a shortage of workers who are engaged in this field, both on the mental health side and substance use disorder side. And we have to get creative because otherwise people fall through the cracks, and that's sometimes a life or death matter.
And also the people we serve in our population, they might have addiction, severe persistent mental illness, coming out of incarceration. They are also available to work and want to be part of the workforce. In fact, that improves their health and well-being, and we like to help them along their path to obtain that employment. And I know employers need them as well. You're doing great. That's the end of round one. Now we're going to go into round two. But first, a message from our sponsor, M3.
People today are at a higher risk of experiencing mental illness, housing insecurity, and substance abuse. Do you know the health of your employees, your communities? How can you step up your benefits to better address their well-being? M3 Insurance helps businesses see beyond basic benefits and support employees where they live. It's a meet them where they are approach that LSS delivers to their clients every day. M3 and LSS offer real solutions to now commonplace realities that strengthen employees and inspire communities to thrive. Test your employee benefit strategy now by going to m3ins.com.
Okay, Tammy, you ready to get back into the ring for round two?
I'm ready to get back into the ring.
Let's go, champ. So what do you think are the top 3 barriers for achieving health and well-being in Wisconsin and really across the country?
I think the barriers include the high cost of healthcare. Some people have insurance, some people have inadequate insurance, some people are totally uninsured, and healthcare is costly. I think especially when we're talking about mental health and substance use disorder, stigma is another barrier that people experience. They're afraid or ashamed of seeking help because they don't want somebody to know that they're struggling with a mental illness or substance use disorder. And then I think sort of proximity, access to care. And we see that both in rural areas where there's long distances to get to someone who can help. Long waiting lists are issues that impact access throughout the state, whether you're in urban, rural, or suburban areas. And even in cities like Milwaukee, if you don't drive and the care you need is 2 bus rides away, that's an access issue. So cost, access, and stigma.
Yeah, that's interesting you bring that up. I wanted to share a program that we developed. We call it Healthcare Partnerships. And it's really addressing those individuals that are falling through the cracks today. They might have Medicaid, I remember when I was Director of Health and Human Services, when the Affordable Care Act came into place, and many individuals who didn't have insurance now had insurance. But if they were on Medicaid, they might not be able to see a therapist for up to a year. And if they're in crisis, they need to see that therapist now. And so we developed a model that addresses those individuals that are falling through the cracks, working with health systems to provide intensive case management services, wraparound services, looking at the broader social determinants of health, and trying to improve the health and well-being of that individual, but also saving the health systems as well. And we started this pilot. We have some promising results. We substantially reduced 30-day readmissions, saved money, and improved outcomes. For a program like this, what would it take to scale this? Because this is really what we need to do more of. Some of these individuals do need that intensive case management services. Any thoughts around whether it be federal support or legislation or policy that could help advance something like that?
Yeah. I think that there have been some really great creative partnerships like you're describing that I've seen around the state of Wisconsin that could draw federal support. I'll give you it can be within a healthcare system, but it also can be amongst multiple healthcare systems, depending on the locality. I know there was a cooperative partnership between the various hospital systems in Madison, sort of trying to figure out who were the people who were falling through the cracks. But rather than one health system bearing all the responsibility, they partnered with each other. Now, usually they're in competition with each other, but they partnered with the idea that they would all collectively save money through that investment to keep people out of emergency rooms or out of hospitalizations. So I really like that approach. And, in part, it can be some people, after the Affordable Care Act was implemented, didn't really know how to get health insurance. And so having navigators that help you figure out what's right for you, that you can afford, but it also covers the things that you're challenged with. And, when people become insured, I think it's great if they can find a primary care doctor and just have regular wellness checks. Now, we're probably talking about a different population now because the partnership that you describe is focused on people who probably have chronic or acute conditions that need immediate attention. But again, back to the prevention idea, if you get somebody signed up for annual wellness checks, they're not spending much out of pocket to do that, they're able to access it, you can prevent so much. You can prevent things from getting worse. And you can encourage people to, when something's wrong, don't go to the emergency room. Just call your primary care doc. There's a lot we can do with connecting people to a healthcare home.
Thank you for sharing that. And yeah, those wellness checks are important, and you need to do them frequently. I go once a year. You
Me
probably
too.
do as well, and it's something that everyone should do to really prevent those more.
And the population that you're describing probably never benefited from years and years of annual wellness check, annual physical. But, so we need to, again, work both the acute and chronic side as well as also the early intervention, prevention.
Going back to the Medicaid population,
Yes.
so roughly a quarter of the population in Wisconsin are on Medicaid. And as we talked earlier, the reimbursement rates are very low. That's why that earlier example I said, when somebody has Medicaid, they might not be able to get to a therapist within a year, which we know is too late.
Right.
What are your thoughts about Medicaid, the reimbursement rates, and should they be improved so that we can address the needs of these individuals more proactively and better?
Right. So first of all, I have to name the big issue in Wisconsin is that our legislature failed to accept Medicaid expansion. Probably 90,000 more people could be served by Medicaid had they chosen to expand. And it's not too late. They can still do it. But the Affordable Care Act gave every state the option of expanding their Medicaid with a very sizable federal match, starting out at 100% and then going down to about 90% federal match to 10% state match. We have, everyone should call their legislature in the state and say, expand Medicaid. That would be a huge step forward on the issues we're talking about. That said, the reimbursement rates are inadequate. The reimbursement rates, since Medicaid generally is a federal-state partnership with more money coming from the federal government than the state, but the state panel is the one that sets the reimbursement levels for various medical visits. And a lot of times we find that we have fewer doctors willing to serve Medicaid, people who have Medicaid coverage, because they know that they'll be reimbursed probably at a rate less than what it costs for them to serve that patient. We have to figure out better incentives, and I think the partnership you just described is one of those incentives of if we can have greater buy-in and support behind those individuals who are Medicaid eligible, it can become a better proposition for providers to serve that population. But it is distressing. I mean, I hear it a lot in mental health care. I also hear it a lot in dental care. And there's many dentists who will not accept Medicaid eligible or people who are on Medicaid because they won't be reimbursed fully for the services they provide. Well, then we have to get creative and think about how are we going to get that health care to the people who need it.
Absolutely. And I know my friend Rob Henkin at the Wisconsin Policy Forum is doing an analysis on the expansion of Medicaid. And he's one, this organization is respected across the aisle. So hopefully we get a good information, get some good momentum relating to what comes out from that report.
One other thing I wanted to mention, you talked about the percentages overall of Wisconsinites who have their coverage through a Medicaid-related program. It's nearly half of all births are covered by Medicaid.
Wow.
And so that's another area that I've been really focused on to make sure that mom and her baby continue to have Medicaid coverage for up to a year after the birth. In Wisconsin, it is perhaps a much shorter period of time, although we've given the state the option to elongate that. I think that's another area where it is so important during a new baby's life and somebody who's immediately postpartum to have continued access to health care.
I agree. So I'll fight along with you for those new babies and Medicaid reimbursement that's adequate to address the needs of the people we serve. So thank you, Tammy. 2 rounds down, 1 to go. You're doing great.
Thank you.
Subscribe to In the Ring Podcast now on YouTube. Like, follow, and share on social media and wherever you get your podcasts. Doing so will allow LSS to expand our reach and message so others within our sector can benefit from these important conversations. Let's go, champs. Are you ready for the final round?
I'm ready.
Let's go, champ. What is your feeling about the political polarization that I think exists amongst both parties? Tell me a little bit about your thoughts on that.
Yeah. I do think it's very distressing for folks to see these deep divisions. I think just growing up in Wisconsin, being a Wisconsinite, that we're used to coming together to solve challenges. And to see on the national level the divisions that we're seeing is frightening and in many ways off-putting to people, so they are less likely to participate. But I'd like to share the other side of it. We read about the controversy because that's what sells newspapers. That's what sells news programs. Yeah. There's a lot that happens on a bipartisan basis every day. And in the Senate, where you need to be able to get 60 votes out of 100, not just a simple majority to advance legislation, if you're going to succeed, if you're going to pass things, you have to work together. When there's a new class of senators who've just been elected, I like to meet all of them, but I also like to say, maybe you represent a state with similar economy, and we can work together on this. I remember actually pairing up with a Republican senator from West Virginia on issues of substance use disorder, because West Virginia and Wisconsin were having similar experiences in terms of the introduction of fentanyl and the need for services. And we have remained bipartisan pair fighting for more resources in this arena ever since she was first elected to the U.S. Senate. Every day, things like this happen. I was just telling you during the break that I chair a subcommittee of the Appropriations Committee that funds the U.S. Department of Health and Human Services. And this same senator is my Republican counterpart. And yesterday, our bill passed out of committee on a 25-3 vote. That's bipartisanship. And it really does happen every day. But you're not going to make the headlines like Republicans and Democrats worked well together to do this. And I'm not suggesting that there are not deep divisions and issues that become very polarized, but I just want people to know that their voice still matters, that their participation still matters, and that things, for those of us who focus on successfully responding to the challenges of our constituents, we have to work across the party aisle.
I agree, and I'm glad you shared that because I do hear that sometimes that a lot does happen behind the scenes, and there is bipartisanship. But I also hear that back in the 80s, we vehemently disagreed, but then spouses met with each other and across the aisle and had dinner together, and I hear that doesn't happen as often today. And it feels like the polarizing issues that are very divisive divide us. And so many of those issues, including health and human services and health and well-being, which should be in the center and good for everyone, doesn't always get addressed because of those polarizing issues. So I am encouraged that you're saying there is bipartisan efforts behind the scenes. And I would encourage you to be more vocal about that.
Yes.
Not only you, but your colleagues, and say, look, this is how much we do actually do together and how much we accomplish together. Because that would resonate, I think, with a lot of people that are sometimes jaded about the political environment. What do you do specifically to strengthen those relationships across the aisle? And maybe mention a little bit more about some of your efforts and some of the bills you passed.
Well, I can give you one just this week. That was, but how did I start? So the last class of senators who came in, I looked, what issues did they run on? What's their home state like? Who can I pair up with on my manufacturing agenda or my agriculture agenda or my human services agenda? And so one of the meetings I had, I'm just going to name drop because it's in the news right now, was with J.D. Vance, the new senator from Ohio. Yeah. I had worked a lot with his Republican predecessor, Rob Portman. I was like, okay, are there any of the bills that Rob Portman and I worked on together that J.D. Vance would like to continue? But we started talking about manufacturing. So Wisconsin's a state that makes things. Ohio is too. Yeah. And just yesterday, a Baldwin-Vance bill advanced out of the Commerce Committee.
Great.
And it's a kind of very specific bill that says whenever we use taxpayer dollars for research and development that ends up in some new innovation or invention, let's not let that idea go to be manufactured overseas. Whenever possible, let's have it done here. And it became necessary because we had some major breakthrough technologies that were developed in the U.S. that are being made now overseas. It was like, why wouldn't we want to lead that after it is our tax dollars that were invested? So we call it Invent Here, Make Here. And so Baldwin Vance, Invent Here, Make Here, passed out of committee this past week.
Great. Thank you for sharing that. I'm starting to read Vance's book.
Oh, yes, I read it. It's very relevant to the topics that we're discussing. But it also is a sort of example, you asked about division in politics and the polarization. And in some ways, he and his running mate, Donald Trump, are very much associated with that division and polarization. But it doesn't mean that on a day-to-day basis, when each of us are fighting for our states and the people who sent us there, that we can't work together.
That's good, because your constituents are wanting you to work together, and it's really important. And so I'm glad that you're able to work across the aisle and do that effectively, because that's important. How are you engaging organizations in the community to help you with your human services platform, or just generally to help you be a good senator to represent your constituents?
So showing up is really important to me as a senator.
Showing up here, by the way, thank you so much.
Absolutely. And so I travel the state extensively. Sometimes around different issues, I bring folks together for roundtable discussions. So by way of example, I've been doing a tour of the state where we're talking about the fentanyl epidemic with law enforcement, first responders like EMTs and paramedics, county human health and human services and public health department, and the organizations they contract with to provide the direct services. These roundtable discussions have truly informed my agenda. I want to hear from the grassroots. And in some cases, we have something where, I can bring federal funds to bear for, say, a pilot project that's being scaled up, or things like that. And so I have been able to secure federal funding for new projects to see what works, or to scale things up that are very pertinent to the topics we've been discussing.
Senator, I just want to thank you for doing that, for convening those groups, because someone like you can do that and do it effectively. People respect you, and good things can happen in terms of collaboration, because a lot of time we're siloed and we work separately, but someone like you that comes in and brings us together can make big and important things happen. So thank you so much. That's the end of round 3. But before we end, we're going to learn how you bob and weave and roll with the punches with a few questions.
Great.
Try to answer the following questions with the first thing that comes to mind. You ready?
I'm ready.
All right. What's your favorite Wisconsin destination?
Oh, you can't be a senator and have a favorite, but Madeline Island.
Okay.
So that's an island in Lake Superior, the Apostle Islands, which is a peaceful escape.
It is beautiful. I've been to Apostle Island. It's been a long time. I need to go back. Thank you for reminding me. How do you incorporate wellness into your weekly routine?
I will occasionally do guided meditations. I'm really bad at doing it without the guiding part. But that is a way to just take the clutter out of your mind, think about the breath, and to lower the stress.
Absolutely. I do meditation every day as well, and it's something that helps me. It's sometimes hard to stay focused, but it's something I do at least a couple times a day to make sure I'm
Good
grounded.
for you. You're much better at it than I am then. But actually, we're not supposed to say better or worse. You're supposed to give yourself a break. It's meditation, right?
Yes. It's all good.
It's all good.
Whether it's a minute or 30 minutes, it's all good.
That's right.
Which of our 4 Wisconsin seasons do you prefer, and why?
Summer for sure. I'm a summer girl. I like the heat, actually, and everything's in bloom. Everything's vibrant colors, and oftentimes people are less, it's a slower pace. The kids are off school. Maybe the people take a little bit of a break. So I think we all have a very sunny spirit in summer.
With my Puerto Rican roots, I love summer too. The winter is kind of harsh, but I do love our 4 seasons. Wisconsin is beautiful. I just wish winter was a little shorter. What advice can you give to young professionals that are just starting out?
Just starting out. So I think, I'm just thinking back to when I was just starting out. So got out of school and I did a couple of, back then I guess I called them internships, but like try out different things to make sure that, if you can, to make sure that you're sure of the direction you want to go in. So in my case, I went to law school and I practiced for a little while at a small general practice firm. I knew that the issues and challenges that my clients were facing, I felt passionately about, but I also began to discover that I might want to set policy rather than deal with each particular case, so that I was touching more, making a bigger difference. And that's how I figured out that I wanted to run for office, first at the local level and then at the national level. Right. But I figured that out by, I shadowed some folks. I asked if it'd be okay if I hung out with them and see what they, if you can avail yourself to those opportunities. Pick a mentor, for example. All of those things kind of expose you to different approaches.
Great. Somebody watching right now might be encouraged to run to office because of your insights there.
Yeah.
Thank you. Final question. What is your game plan for spreading the word about our sector and the needs that we discussed today?
My game plan would be to continue to travel the state and get input from those on the ground who are providing services for or that have firsthand experience with human services, with helping people who have mental illness or mental health issues, behavioral health issues, and then applying what I'm hearing in my job. But you asked me more about spreading the word. These are challenges throughout the state of Wisconsin. And I continue to travel throughout the state. They may not be identical in every location. And there might be new ideas in places about how to confront things. But going there and bringing people together is how I elevate those issues.
Great. Well, I thank you so much for being in the ring with me today, because your insights and perspectives are helping spread the word about the good work that the social services sector does to improve the health and well-being of all Wisconsinites. Thank you.
Thank you.
As always, you can find all of our interviews on our podcast website. Subscribe to In the Ring on YouTube and follow us on Twitter and LinkedIn so you don't miss any important updates and interviews in the future. Thank you again, Senator Baldwin, and thank you to our sponsor, M3. Con mucho cariño, with much affection. Bye.